Hello, my name is Stefano Luminari. I'm professor of medical oncology at the University of Modena and Reggio Emilia in Italy. CAR-T actually represent a major step forward in the management of relapsed refractory diffuse large B-cell lymphoma. We have significant results from phase 2 studies that enrolled patients with 3 or more lines of therapy. And we have significant results also from randomized phase 3 studies that enrolled the patient at the first relapse. The most important evidence actually comes from the second-line therapies, and in particular from these randomized phase 3 studies that clearly showed that the use of CAR-T, and in particular axi-cel and liso-cel, were able to achieve better results compared to standard therapy that in both trials were represented by systemic salvage chemotherapy, immunochemotherapy, followed by autologous stem cell transplant in case of response. In particular, both studies were positive and led to the approval of CAR-T use, and in particular axi-cel and liso-cel, for the relapse of diffuse large B-cell lymphoma, which occur 1 year after the completion of first-line therapy. And this has resulted in a significant and paradigmatic change in the current approach of relapsed refractory diffuse large B-cell lymphoma, which now should be assessed for eligibility to CAR-T instead of being assessed for eligibility to autologous stem cell transplantation, which represented the major statement from pre-existing and previously used guidelines. This has represented a major change, and I think we could call this a paradigm change in the management of relapsed refractory diffuse large B-cell lymphoma. And most important, the results that have been obtained with these studies, and in particular with the ZUMA-7 study that was based on the use of axi-cel, not only was able to show better results in terms of progression-free survival, which was the main study endpoint, but also in terms of overall survival, which resulted at late follow-up analysis to be improved with the use of axi-cel and CAR-T in the second-line setting. What was also very important in this study that has an important lesson to take home is that this difference was observed even if patients randomized to the standard arm in the 57% of the cases were crossed over to commercial CAR-T when they did not achieve a response prior to undergoing to autologous stem cell transplantation, or when they experience a subsequent relapse. That has a significant important message. That is, the earlier we use CAR-T, we prescribe CAR-T in relapsed refractory patient with diffuse large B-cell lymphoma, the better is for the patient. This is an important clinical message, but this message is also important clinical implication, because to be timely in the administration and in the prescription and the administration of CAR-T, we need to identify patients who can benefit from CAR-T. I mean, patients who are at high risk of relapse as early as possible, also during the administration of first-line therapy, or also I would say before starting first-line therapy. I mean, patients with high-risk features who are high-risk FLIP-EP scores, who are less likely to respond and to benefit from a standard first-line immunochemotherapy, no matter what first-line immunochemotherapy is, should be carefully observed and monitored for their response in order to catch the earlier sign of relapse and to be very timely in the in acknowledging and in proceeding with the indication to proceed with CAR-T, and namely with axi-cel, which is the product that has made the best results in this setting. So in conclusion, with the data available from the randomized second-line trials in diffuse large B-cell lymphoma, it is now clear enough that CAR-T therapy, and in particular the use of axi-cel as are representing a major step forward in the management of the patient with relapsed disease. And in order to accomplish and to follow the results and to reproduce the results, we need to be very carefully observing our patient and identifying high-risk patient and a patient at early relapse as soon as possible in order to offer this patient the best chances of being cured from their disease. Thank you for your attention.